Good morning, everybody. I'm Judy Stevenson. I'm the Montgomery County Small Business Navigator, and I'd like to welcome you to this edition of the Montgomery County Economic Revitalization and Recovery Town Hall. On behalf of County Executive Mark Elrich, we welcome you and hope that you get information today that's helpful to you and your businesses. The County Executive implemented this ongoing town hall to provide businesses with direct access to county leadership and get updates on different programs that are related to the pandemic that might be helpful to them, or things that are coming down that would be helpful for them to be aware of. So today I'd like to start also reminding you that interpretation is available for this town hall. On your screen on the bottom, there is a globe button that you can press for interpretation, and then you can hear this town hall in Spanish. So if that's helpful to you, please go ahead and do that, and you will hear the interpreter providing a Spanish interpretation. So in addition, I'd like to actually provide some updates on some grant programs that are available. At the state of Maryland, there is Project Restore, and applications open for this on Wednesday, September 8th, and will be open until October 8th. Now, this is a program that is being administered by the State Department of Housing and Community Development, and it provides rental assistance grants and business operations grants. Now, it's very specific because it's for applicants that are either moving into space or expanding into space that has been unoccupied for at least 6 months. But if that applies to your business, I would encourage you to go out and look for the details on that. It is, if you just do a search for Project Restore, State of Maryland, you'll find it. We will follow up after this town hall with a link to that information. So that is something that is active at the state level right now. I also wanted to provide an update on a grant program that the Montgomery County Economic Development Corporation ran. This was a nonprofit grant, but it's for nonprofits that are providing services in the economic development arena. So it's nonprofits that are providing services basically to businesses in some specific categories. So there were 40 applicants in the phase 1 of that grant program. They were eligible and approved for grants for a total of about $1 million in that first round. Those grantees have been notified and payments are in process. There was a phase 2 period, which also closed, and those grants or applications are being reviewed now, and those awardees will be notified. So I would encourage you to monitor the Montgomery County Economic Development Corporation's website. There will be at some point a list of awardees and what those programs are, so that you might be aware of some services that are available to you through Montgomery County nonprofits. That was a program that was funded also by the state of Maryland, and again administered by the Montgomery County Economic Development Corporation. So at this time, we have Sylvia Kinch with the Montgomery County Attorney's Office also joining us today. And we're going to ask Sylvia to give us some updates on the current environment related to the pandemic and some things that are being discussed at the county level. Morning, Sylvia. Thank you so much for being here.
Good morning, Judy. How are you? Thanks for having me. I would start off saying that I think the biggest news with regards to the pandemic and is vaccines and the vaccination mandates that have come out of the federal government. As many of you know, our president announced sort of some sweeping vaccine mandates, but we've yet to see sort of the actual text of any regulation and what impact it will have. Of note, any employers who have over 100 employees will be required to have their employees vaccinated or to have the employee provide proof of a negative test on a weekly basis. More info on how that is going to be rolled out and how private employers will be able to show that they are complying with this new regulation are expected to be released from OSHA, hopefully soon, because I think we all have questions. Additionally, any businesses that receive funds or money from Medicare, Medicaid will also have to have their employees vaccinated. That is in line with, I think, a move to have more people vaccinated, which obviously our public health officer, as well as our county executive and our council all support. Towards that end, the county is taking a serious look at New York City's Vax Pass, where they require that city residents have proof of vaccination in order to enter certain business establishments. It's important to note that a lot of businesses are doing this on their own. I've heard of some businesses in DC, as well as some in Montgomery County, that are already requiring people to provide proof of vaccination or to provide a negative test, sort of taken within 72 hours of the time that they're entering the facility. But if the county decides to adopt this, this would make it more formal. It would likely be limited only to certain businesses, just like it is in New York. It wouldn't impact retail establishments, but it would more likely impact places where you expect people that don't really know each other to be in a space for a long period of time. So I think your restaurants, your gyms, places like that. So that's pretty much the news that I have with regards to vaccines. I will note that even if the county does adopt a Vax Pass, that would not allow the vaccinated individual to not wear their mask. Currently, the county is under a mandatory mask order or regulation from the Board of Health. That would only go away once the county's community transmission rate has dropped. We're currently at the high level, which is the highest of the 4 levels. We were at substantial a few weeks ago, but the goal is to eventually go down to what is moderate, which is the second to lowest level of community transmission. So until that happens, people will still have to wear masks.
Sylvia, one thing that I recall from the president's speech and would impact Montgomery County businesses, first of all, well, Montgomery County residents, government employees are going to need to be vaccinated. But I believe he also said that contractors will have to be vaccinated, and they're not making any allowances for testing. Basically, it's you're vaccinated, you're required to be vaccinated.
So yes, so there is a federal contractors will have to be vaccinated. However, there are certain protections that workers have just innately. So if there is, for instance, a medical reason why the person cannot be vaccinated, then or perhaps a religious reason why the person cannot be vaccinated, the employer will have to go through the reasonable accommodation process to determine how can they be accommodated. And that may include testing. It's just that testing is no longer going to be offered as an option for those who do not have a medical or religious reason for not being vaccinated.
Okay, thank you. Thank you for that clarification. So I do know we are expecting Dr. Stoddard to join us, but he is running a little late due to another commitment. So if he is able to join us, I will try to allot time toward the end to allow him to provide updates as well. But now I think what we'll do is move into our presentation from Marianne Souders, who is our Acting Director of the Office of Emergency Management and Homeland Security. We've asked Marianne to join us to talk about emergency preparedness and disaster planning for businesses. She has an extensive background in the field, and I know she's going to have an awful lot of great information to share with you all. Marianne, thank you for being here. I'm going to turn this over to you at this point.
Okay. Hi, everyone. Thank you for inviting me to speak. I did develop a presentation. I think that was the easiest way for me to share some of this information with you. Can you see my screen?
Yes. Looks good.
Okay. Well, this is not the one I wanted, of course. Oh, no matter how many times you practice, right?
That's all right, no worries. And I will say that I will post Marianne's presentation on the Montgomery County Business Portal website. We'll also follow up with a link. We were going to send you a link to this grant program. We'll also attach Marianne's presentation as well. So I think you're,
there we go.
There
okay.
you go.
There we go. Okay, sorry about that.
No
A little
problem.
bit technologically slow. So good morning. So I've been invited to talk a little bit about business continuity, how businesses can plan for those rainy days. Things go wrong. It can be something minor, it could be something major, but in any case, it could impact your business and your revenue. So I want to start out, I'm going to ask some questions, but they're more rhetorical, give you something to think about, not necessarily have to answer on the presentation, obviously. What keeps you up at night? What are the things that scare you and worry you? What are those what if scenarios that you kind of think about? What am I going to do if this happens? It could be a fire, flooding, utility outages, including power, water, or even your phone or internet. IT problems, cyber attacks, that's a big thing these days that we have to really worry about, all of us. Supply chain issues, can your vendors get the materials you need or get them to you? Is it the supplies or is it the transportation? All these different kind of things. There's a myriad of things that can happen. But when you have a disruption, it not only, the main thing is it leads to loss of revenue. It can damage your brand. It can cause your customers, consumers to be really dissatisfied or left without. The longer you are out, the more revenue you're going to lose and more issues you're going to have down the road. So business continuity is one of the ways we can protect against that. There's a lot you can do. There's a lot of forethought, things you can do ahead of time to address some of the concerns and prepare yourself so that when it does happen, well, it'll be bad enough. It won't be as bad as it could have been. So you want to develop a plan. It doesn't have to be a 90, 100-page plan, but a framework that you can refer to and to keep everything in a line to help you when these things happen. And in doing that, you want to start with identifying those threats and hazards. What are the things that are likely to happen or could happen to you? Where we are, a tsunami is not likely going to impact you, but fire, tornado, hurricanes, flooding, anything like that can disrupt your business. Then you want to look at your vulnerabilities, your weaknesses. What are the things that will be mostly impacted and how? So what is a business continuity plan? It's a document. It outlines how your business is going to continue operations and in what scope when this event happens. It's more than just looking at your technology and how you're going to keep your storefront open. It's planning for your employees, your customers, your technology, your supply chain, everything. So first off, you want to look at what are your critical functions? We call them mission critical functions in emergency management. What's the mission of your company? And what do you have to keep running? What do you have to do to maintain, regardless of whether you're displaced, whether your technology's down, etc. I mean, this could be like payroll, paying taxes, providing services. You have to identify these critical things because they're the ones you're going to want to focus on. The not so important things that can be pushed down or not paid as much attention to can kind of sit by the wayside a little bit, but you have to identify what are the things you've got to do and what do your customers expect from you. So the first thing we'd like to, we do is do a business impact analysis. And this determines your potential impacts and then the resulting interruptions. So we want to look at your like I said before, identify your hazards and look at how likely is a certain hazard or threat to, how likely is it to impact you? Again, back to the tsunami, that's not real likely in our area, but there are many, many things that are. And then you look at your weaknesses, your vulnerabilities, how is this going to impact your business, and what you can do to be prepared. We break down our threats and hazards in emergency management, and I guess across the board, into several different categories. There's intentional threats such as terrorism, sabotage. There's unintentional, civil unrest. There's fire, floods, tornadoes, all the natural hazards that happen. And then there's things like we just are going through now, not just went through, but are going through, the pandemic. All of these can have a significant impact and disrupt your business depending on what you do. So if we look at our hazards, whether they're technological, they're terrorism, they're fires, explosions, pandemics, all of these, and then you look at the things that you have with your business that are your vulnerabilities, your people, your staffing, your building, your supply chain, your technology, all of those things. And then you look at how the hazard will impact your assets and what you can do. So what do I need? What do you need to perform your critical functions and to keep your business up and running? You're going to need your people, you're going to need your staffing, your human capital, your facility. Oops, sorry about that. Didn't want to go back that far. Uh-oh. Not sure how to go back. Okay, I'm going to just kind of wing it. So you're going to look at all these different things and identify what you can do ahead of time to prepare. You also need to look at your interdependencies. Sometimes you may not be impacted, but your supplier could be impacted and you not be able to get your equipment, your supplies, everything you need to perform your business. I know that through the pandemic, a lot of that has taken place when we've had disruptions in transportation because of the workforce and a myriad of other things. You can look at those too, because that you have to take that into account. Things that may indirectly impact your business operations. One of the things you want to do is think about if there was a incident that impacted or damaged your building, prevented you from accessing your building. How would you operate if it's a storefront and you can't get in there, or it's damaged, or all your goods are damaged? What do you do to keep your business going? This year has shown people have been so innovative in how they've run their businesses. There's been a lot more online sales, and like the restaurants serving outside and doing carry out. Those are all innovative ways to keep your business going when you can't actually operate out of your facility. One of the things you can do is to designate or try to identify someplace you could set up temporarily in an alternative site. That's a little bit easier for us at government because we have a lot of facilities and we can move around. A private mom and pop shop may not be able to do that, but if you can, that's a really great idea. You have to identify your processes. Another thing to identify is who's in charge. What if your manager, your owner is unavailable, or God forbid, injured, and they can't make the decisions? Who is next? We call that the line of succession. Who is next in making these the major decisions for the company. You have to look at your employees, their roles and responsibilities, how they can fill in the gaps, and train them on how they can continue to operate outside of the business if something were to happen. A really important thing is to keep your vital records, your documentation, and all of that backed up in another location that's accessible. You know, we keep everything on our computer. A lot of time it's in the cloud, so you can access it regardless of where you are. But some of your physical paperwork, you may not want to keep in your facility, or at least keep copies in a safe or a safety deposit box somewhere else that you can access and get to them. Additionally, you want to do the same thing with your vendor information and your contracts. And you also want to, you know, have kind of a communications plan where you can continue to communicate with your staff, with your contractors, et cetera, should you lose your technology. What if you don't have email? Do you have a contact list with their phone numbers and everything where you can contact them directly? Okay, so another thing that we also recommend outside of the plan is to develop a kit. We tell all our citizens all the time, you know, we encourage them to have a kit for emergencies, because if something happens and they can't get out, or you're stuck in your business for whatever reason, and it's not so much of your facility is damaged, but you can't get away from there, what do you need? Water, you always want to have cash on hand, some food, radios, flashlights, chargers for cell phones and computers. There's a myriad of things that we recommend you keep on hand. And, you know, that's just as useful as from a business as for a, you know, a residence. Keep your staff involved. Once you develop the plan, go over it, review it with your staff, train them, practice, even do drills. Businesses can do drills just like government does. You can, you know, set up a scenario and kind of work through all the processes to make sure you can be up and running. Encourage your staff to make their own kits, and so they're resilient. And also have them make plans with their family so that if they are caught in a situation and they can't get home, that they can know that their family is taken care of as well. So your primary focus is the safety of your employees, your customers, and all that. But you have to think about all of the different impacts, things that could happen, and play the game. Work through those scenarios. If it's a fire, what if my business is destroyed? Where do I go? Who do I need to contact? How do I get back up and running as soon as possible? Train your plan and exercise it. Before I go into any questions, the Office of Emergency Management and Homeland Security is there to support and help you if you have questions. Obviously, we can't write everybody's plan for them. We don't have the staffing or the ability to do that, but we're certainly available if you have any questions or need any assistance. Does anybody have any questions now?
So Marianne, let me ask a couple. Given, you know, I know a lot of businesses don't really like to think about this, right, on an ongoing basis, but I think that we have learned just over the last 18 months that it's something that they really should be doing. Would you encourage them to kind of document some lessons learned from the pandemic, things that they were able to do, things that maybe were continuing challenges? You know, would that be a good exercise for businesses to be going through right now?
Judy, that's an excellent point. Yes, we have all learned so many lessons over the last 18, 19 months. I've lost count. People have been innovative. We've come up, this has brought to the forefront some of these vulnerabilities and how different things impact. Who would have thought a health emergency would shut us all down? And taking those lessons learned, applying them to different scenarios would be extremely helpful. Take
So
what
yeah, I
you've
think
learned.
you mentioned all hazards, right? So
Yes, ma'am.
when people are thinking about these things, they might be thinking about, oh, that's a flood, that's not going to affect me. But the point is that the plan would apply to pretty much anything that might disrupt their business.
Absolutely, because it really doesn't matter what causes disruption. It's the fact that it happens and that your normal business practices just aren't going to work right now. So yes, absolutely.
And I wonder if you would recommend that businesses visit your website, because I believe you have some really helpful tools on the Office of Emergency Management and Homeland Security website that businesses can use, that are templates that will walk them through, just like your presentation did, in thinking this through. So I'm assuming that visiting your website would be really helpful.
That would be fantastic. We try to keep as much information on there as possible, update it regularly. There is a lot of useful information on our website. There's also a lot of information on FEMA's website, but absolutely.
And then, do you have staff available to go? Like, I know we partner very strongly with our local chambers of commerce. I mean, are you available to do a presentation to their membership, just like you've done today? I mean, is that something that's available? I know you won't do the plan for the businesses, but you can help walk them through how to do a plan.
Sure. We actually have an outreach coordinator that can go out and do presentations, talks, tabling events, whatever it is that you need.
And is that something they can coordinate on your website? Is there something there that helps people see how to make that request?
Yeah, I believe there is.
Okay.
To be honest with you, I have to double check, but I believe that there is a link where you can sign up.
Okay, and I'll make sure that in follow-up information that we include that link as well. Hopefully you're not inundated, although I'm sure you're happy to go out. Okay, I think that answers the questions that I have seen. If you are done sharing your screen, maybe we can take that off. And I believe that Dr. Stoddard is now with us. So I wanted to see if he would have a chance to provide some updates from his position as well. Thank you, Dr. Stoddard, for being here. I know how busy you are.
Good afternoon now. Apologize for being a little late. We had our September 11th memorial ceremony at 11 and it ran a little bit long.
Speaking of disasters, right?
Yes, indeed. Just wanted to note, and for Mary Ann's benefits, if you go to the training opportunities, there is a place on there for community presentations, and you can request a community presentation on the website for emergency management. I was looking, I had to verify as well. So Mary, don't feel bad that you didn't know. So I had to go look, but you can do it. So there is a place where you can enter your information, location of the event, expected date of the event, and they can help provide presentations. So on the COVID front, so a little bit of a mixed bag of information today. So we have seen a little bit of a decline in our COVID-19 cases, which is a good thing. Obviously, we had implemented the face covering requirement a number of weeks ago as an effort to to have our numbers come down a little bit, particularly in the weeks leading up to and the beginning of our academic year for both Montgomery County Public Schools and our non-public schools. So that effort seems to be working because we have both flattened and we are seeing a slight reduction in the curve, which is great. We're hopeful that continues, but we know as the weather tends to cool, people do more activities inside, and we have concerns that could result in what has happened, happened last year at the same time, right around Thanksgiving and thereafter. We did see a spike, and we are concerned about that this year as well. That said, we have many more tools in the toolbox this year, and we are hopeful that those tools will expand our ability to respond. Obviously, our vaccination rates remain amongst the highest in the country. I'm going to pull them up now, and I'll go over them in a second. But The key is obviously that if you have, I know Ms. Kinch already spoke about vaccine passports and things like that, but if you just continue to encourage vaccinations as a mechanism to keep people safe, that's our most potent tool. As the president announced yesterday, and we've begun, we've really been pushing for this in the county as well. We're really expanding our opportunities for testing. And so the county continues to operate testing opportunities that are free of charge. You can come as many times as you want to get tested to those opportunities. Those are PCR tests that typically come back within 24 to 48 hours. Please do avail yourselves as well as your staff of those opportunities, because frankly, that's knowing one's status is an important part of protecting oneself. We are seeing a slight increase in the percentage of people who are vaccinated who do report having a breakthrough infection. That is the same as occurring across the country right now. It's about 35% of our cases are breakthrough cases. But obviously, the percentage of people who have a breakthrough case and end up in the hospital, or the worst case scenario of dying, are monumentally lower, something like 8 or 9 to 1 in our hospital system. So that's a really important point for people to understand. Vaccines are being very effective at protecting from serious illness and death, and we encourage people to get vaccinated for that reason, if no reason alone. Right now, for vaccination rate, at least, so almost 82% of our population, total population, including those who are ineligible, have received at least one dose. Of the eligible population, roughly 96.1% of our population has received at least one dose, and 87.2% is fully vaccinated amongst the eligible population. Now, on the front of when will 5 to 11-year-olds become eligible, Dr. Fauci provided an update yesterday. The timing of that is a little bit out of the hands of the government at this point, only because Pfizer and Moderna both have to submit the data for their earlier age children's studies. It is a dosing change, so it can't just be rubber stamped as expand the eligibility. The dosing has been cut by a third. It's a third of the doses for adults for 5 to 11-year-olds. And so that data is expected to be submitted by the end of this month or early October, and the FDA expects it'll take 3 to 4 weeks for it to review the data, and ultimately, if they decide to approve the emergency use for 5 through 11-year-olds. For the Pfizer vaccine specifically, Moderna is offset from Pfizer by about a month itself. So take those timeframes from Moderna and add a month to them. That means in November, we are anticipating that if all goes well, the vaccines will become available for the 5 through 11-year-olds, which will obviously greatly impact the schooling environment, the academic environment for even this semester. And so we're hopeful that will come sooner than later. I think that covers, I know Sylvia has asked, Sylvia probably gave an update on the vaccine passport. That is something the county is talking about. We will be soliciting some level of business feedback in that process, because we know that has a significant impact on the businesses. And really, we're in the formative process of that there's nothing on that's been imminent in terms of it has not been submitted to the county council sitting as the Board of Health, nor have they reviewed it or given any feedback on it. So that we're in the formative process, because what we're really viewing this as is for vaccine passports as, we do not want to go down the road that we went down last year with business restrictions, gathering limitations, and other things. A passport seems like a potential surrogate for having to go down that road should our COVID conditions worsen to the point where we feel compelled to try and reduce transmission further. Right now, obviously, with the reduction in cases that we're seeing in the recent days, I don't believe anything of that nature is necessarily imminent, although certainly that's a conversation that every day we have as well. Finally, I think what I'll say is we're in the process at the county level of assessing our employee vaccination status. We've heard from, I would say, just about half of our full-time employees. We have some number of recreational temporary staff who are a little bit more complicated to measure, as well as board of election staff who are technically staff but are not necessarily working or when we don't have elections. And so we've heard from about half of our staff so far. They have through the end of next week to report, and we're pleased to report that so far those who have reported, there's 96.4% vaccination rate amongst county employees, which is great. So we're hopeful that holds up through the remaining 50% of employees or so who have to report next week. But we're expecting that the vaccination rate amongst our employees will be no lower than that of our residents. And then after that, we will have a discussion with our employee unions with regard to the follow along testing that we've previously talked about, because we are doing a vaccinated or test weekly process, and how that'll work and the details of that, and work that out. So more to come on that, but that's just sort of the status for the county employees and what we're doing as an employer to protect our staff as well as the clients that we routinely work with. So I think I'll stop there. And if there's any questions, happy to answer them.
Earl, do you have any updates on boosters?
Yeah, so we are doing boosters right now for the immunocompromised. I think the state has said there's roughly, we've done across the state about 28,000 of those across all of the platforms. The local health department is doing booster shots for the immunocompromised. On boosters for the rest of us, we're still waiting for some federal guidelines. There seems to be some back and forth with regard to whether whether they have sufficient data, particularly for Pfizer and Moderna, to do booster shots. As you heard the governor say earlier this week, and you will certainly hear from the county as well, we are very much encouraging the FDA and CDC to make this determination. As the governor said, they're doing antibody testing, particularly in our nursing homes, who are some of the first to receive the vaccine and therefore have had it the longest and are the furthest from their doses. And they're seeing waning immunity in about 60% of those who received the vaccine in nursing homes. So that is a pretty strong indicator that immunity, I mean, they're almost a year out, or they're like 10 months out right now from their vaccination process. Many of our other residents are only 6 or so months out from vaccinations. And so this is something we're going to have to figure out. We're getting in place our processes to enact a booster vaccination process, but that will not start for everyone other than our immunocompromised residents and our nursing home residents until we get further guidance from the CDC and or FDA about that booster shot.
I also have heard that in other countries in particular that there are self-administered tests that are available. Is that something that we have here, that people could just get like a packet of self-administered tests?
Yeah, so I mean, I'm not an advertiser for the rapid testing folks, but certainly a couple things here. So the county is investing more resources in acquiring rapid testing. So I think you'll see those opportunities increase. But as someone who has taken, I took a vacation. When I came back from vacation, I had a rapid test run on myself just because I wanted to make sure before I went back to work that I was negative. You can go to just about any pharmacy chain at this point and get a at home. You get the results. Rapid test takes 5 minutes to read the instructions, 15 minutes to wait for the results, and then within 25-30 minutes of opening the package whether you're positive for COVID-19. These are antigen tests. If the fidelity of a PCR test tends to be a little bit better in terms of, if you're asymptomatic, they're a little bit better tests. But if you're having, if you feel like you have the sniffles, you're not sure, the rapid tests, the antigen tests are very effective. They're readily available. As the president announced yesterday, he intends to make them ubiquitous throughout our community at cost. At cost. So I think if that'll be, that's a huge step. Rapid testing is one of the keys, and in fact, in some settings, it is an excellent thing to use in combination with vaccination to really make sure that you're safe.
So I don't know if you gave this number, and if you did, I apologize. But of the people who are hospitalized with COVID, do you have a number of the differentiation between vaccinated and unvaccinated, or is that available?
I don't have the last data I saw on this, and it's been about a week and a half since I've seen the update for data. We do it weekly, and I just haven't seen the data for this week. It's about 25% of those hospitalized are vaccinated, which is not necessarily surprising given how high vaccination rates are in the county. That's just the leftover remainder of individuals. But of the people who are vaccinated who appear in the hospital, I believe 85% of those are over the age of 65. And so they have typically other conditions that make them at higher risk. And therefore, many times they're hospitalized and then they're detected to have COVID. So I think part of this is a chicken or the egg thing. Is COVID what put them in the hospital, or do they have some other condition, a heart attack, a stroke, they fall and have an injury there, or some other treatment, they go into the hospital, that's where COVID's detected, but because they have those other comorbidities with them, they're end up being admitted, and so it appears as though they're in the hospital with COVID, but that COVID diagnosis may be secondary to the other issue that put them in the hospital. So the data is a little bit more complicated than that, but it's about 25% at last I saw.
And then just to reiterate that we're encouraging, businesses as much as possible, we're encouraging them to encourage their employees to get vaccinated, and reiterating that something that I think Sylvia has said more than once, that businesses have every right to require their employees to be vaccinated as long as there's exemptions for religious or health reasons.
Correct. And obviously the president announced yesterday an effort to the OSHA standard that I'm sure Sylvia talked about. And I'm sure there's going to be litigation and other things surrounding that. They're already, everyone's banging down the door to get into the courtroom to discuss that. But obviously the goal there, whether politically you agree with the president or not, the goal there is to try and, we've made many efforts to encourage people who have been hesitant and have been successful in reducing that percentage of people who have been unvaccinated progressively. COVID resurgence with Delta has helped encourage people, but the last 15% of our population, or maybe slightly lower than that, who is unvaccinated, either is going to have to wait for the 5 to 11-year-olds to become eligible, or they're going to have to be carrots and sticks associated with getting more people vaccinated, and either vaccine passports or vaccine mandates are two of the more stick-like activities that could be applied both by, the government doesn't, we as government don't always want to, we don't want to do those things, nor do we take them lightly, but businesses also are allowed to implement those sorts of things as well. I know there are some restaurants that already are doing essentially a vaccine passport for people coming into the restaurant, both workers and customers. So that's something we encourage businesses to consider and talk through and think about. And we're happy to, if you have logistics concerns or challenges with it, we're happy to talk through and support you in those efforts.
Yeah, I think also some event venues are also implementing and enforcing.
Yeah, I know Strathmore Theater, other theaters are doing it as well. I think it's going to be an interesting, particularly as we move into the fall, it's going to be interesting and challenging in the sense that, obviously there's some percentage of customers who will be turned off by the prospect of a vaccine passport, but there are also some percentage of your employee or your customers who may not be coming to you now, who would be more inclined to come to you if they felt that a vaccine passport would make them feel safer in certain settings. And so that's certainly something that businesses, we encourage you to investigate and make decisions around that. But obviously, that can be tricky to assess and complicated to implement. And we're happy to help support businesses in considering and implementing that.
Okay. All right. Well, I don't see any other questions for anyone, but I wanted to just thank Dr. Stoddard, Sylvia, Marianne, Miriam, the interpreter. Thanks everyone for your participation and assistance today. And, people know that if they have questions, they can reach out. We're more than happy to help or answer anything that comes up.
I saw one more question that came up about the passport legitimacy. So we're looking through some applications that will connect your vaccine status with identity. So there are software tools that are already out there on the open market that will do that, that do some validation with the Department of Motor Vehicles or with other databases of identity, and then they'll cross-reference with the state's local vaccine dashboard to match a person with a person. So those are some of those are being done. But honestly, it's not a perfect system. And what I mean by that is that in some places that are just using cards and identifications, of course, you can forge a card, and that is happening. Typically, most places that have implemented them have also included penalties for people who do that. There have been arrests, certainly at TSA, for people doing that. And so it's not a perfect tool. It's a risk mitigation tool, as many of the masks aren't perfect, vaccinations aren't perfect. Nothing that we're doing is perfect. It's about layering different layers on one on top of the other in an effort to make it's called the Swiss cheese model of protection where no individual layer is perfect, but if you layer enough layers on top of one another, you get closer and closer to a more complete system. And that's what vaccine passports are part of. They're not perfect in and of themselves. There are lots of flaws with them, but done in combination with masking, vaccinations, testing, and other things, they can be a very good tool.
Thank you for catching that. I'm sorry, I missed that question. So if there's nothing else at this time, I think we're going to sign off, but stay safe, everybody. And thanks again for everybody for participating and joining us today. Thanks.